Hi, I'm Sue Montgomery, and this is Dying Talks. Today we're going to talk about what your understanding is of your diagnosis. You know, when I was working in the field in hospice, when I would go into a patient's home for the first time, a newly admitted patient to our program, one of my first questions would be, tell me what your doctor said. Because I wanted to make sure that the patient and I were both on the same page. Because too often, what I found was that the information that we had received, on the patient's records, that was either not what the patient was told, or it wasn't what the patient heard. And that's very common because there's so much stress involved in you're sitting in the doctor's office and you receive this really difficult news. And so a lot of times, after that statement of some bad news, then your hearing kind of turns off, So lots of times people will actually start this journey, or they might get admitted, say, to hospice, and still be confused about exactly what's going on. So I want to start with that with you to say that if you have any questions about, say you've been referred to a hospice, or you've been referred to a palliative care program, or you just have questions that maybe they came up after the visit. That happens all the time. You leave your doctor's office and you say, oh, I should have asked about this or that, or this is not the time to have a lack of clarity. This is the time that you should have all the answers that you need. And I encourage you to, if you have any questions, if your loved ones have any questions, I encourage you to, contact your doctor's office and speak with them about that. Don't be intimidated by the healthcare system, or, I don't know, whatever kind of relationship you have with your provider. You have a right to know everything that's going on. This is your health. And so I encourage you to make sure that you have a good understanding of your diagnosis and, what the plan is going to be. If you've been referred to a hospice program or to another, perhaps a palliative care program, that you know why that is. And if you haven't had a chance to just say to your doctor, what is my prognosis? How long do you think I have? What do you think my life is going to look like in the next 6 months or so? Do that. Ask hard questions, so don't be afraid. I would encourage you to write down your questions before you go to your visit. Make notes as you're going. Don't let anybody rush you. Make sure that when you leave, your questions have been answered. This is a sacred season for you, and you need all the support that you can get, because it's also a difficult one. So make sure, starting out from the get-go, if you've been given a difficult diagnosis, perhaps you've been told that your condition that it's a terminal diagnosis, that you have a limited life expectancy. If you have anything about that that's confusing, go back to your doctor's office and ask more. As always, this is Dying Talks. This is general information, and you should always check with your healthcare team about your specific needs. I'm Sue Montgomery. God loves you, and so do I.